Alabama Department of Public Health, there has been 3,089 total hospitalizations for COVID-19. Of those cases, 888 have been placed in the ICU. Ileana Capian joins us live from the newsroom to tell us more about the bed availability in one of our Wiregrass Hospital's intensive care units. Ileana, good evening.
Good evening, Mike. And that's right. Unfortunately, the state health officer, Dr. Scott Harris, announced that the state of Alabama is at an all-time low with the number of ICU beds available. And here in the Wiregrass, the case is no different. Southeast Health is currently using all 42 of their ICU beds, meaning none are available.
Well, I think some of it is COVID, but I think some of it was just the general need for patients who are acutely ill.
Currently, Southeast Health has 26 patients in their hospital being treated for COVID-19. Not all of those patients are in critical condition.
All COVID patients are not in ICU. So there's some COVID patients in the ICU, but the majority of the patients are not in COVID. So the ICU is not just COVID patients, it's all patients that meet the needs for intensive care. Give me the number of COVID patients we have in ICU currently.
Southeast Health has 2 intensive care units that in total hold 42 ICU
Still
beds.
8. Okay.
Of those 42 ICU beds, only 8 of them are being used by patients being treated for COVID-19.
And our 32-bed unit is where we actually house or cohort the COVID patients.
Knight says this shortage is not an uncommon challenge for them. The hospital has throughput meetings daily to transition patients that are no longer in need of critical care to different places in the hospital to make room for more critical patients.
That being said, though, we have been proactive in surge planning. So should the need arise, you know, we've met to discuss how we would expand and adapt to that need. So that would include staff planning, space planning, supply planning, all of those things that would be critical and if the need arose.
And Tina Knight tells us Southeast Health is in constant communication with the Healthcare Coalition and other hospitals within the region so that they can plan for if there is a surge and a need for more ICU beds in their hospital or across the state.
All right, Ileana, thanks so much for that report. Well, folks.